So my name's Lucy. I run Wild Things Rescue, which is a wildlife rehab charity in Lincolnshire. We worked up from, so I started rehabbing at home just over 10 years ago, and then I've built it up and we opened our centre in 2022, I think, and we're just in the process of moving to our new site. So we're going to do a presentation in a minute. I'm going to do some of the waffling and Emily's going to do some of the waffling, and I will hand over to Emily to just introduce herself.
Hi, I'm Emily. I am the head of the animal care at RSPCA North Wilts, formerly known as Oakham Furrows. I'm also a veterinary nurse. I've worked for wildlife for quite a few years, so probably up to 15 years now. And the noise that you can hear in the background is a very noisy cockatiel. But yeah, I'm going to look at it from both sides, but probably more veterinary side than rehabber side, and Lucy will look at it as the rehabber side. I'm going to
Yes.
mute myself in between so we don't hear the noise.
So we don't hear shrimp shouting. So I'll just share my screen and we will begin with the slides. So as Emily said, she's a veterinary nurse, so she's seen things from like the practice side of things. I worked in practice as a nursing assistant, and so that's where my rehab journey started. But I'm going to look at things from a rehabber point of view, and specifically how I built relationships with vets as a home rehabber and how I maintain them and how I've built them across the way. So we're going to be looking at working alongside a vet, the legal reasons why we want to, the practical limits, and how it forms better outcomes for wildlife.
So we're just going to go over a little bit of why it matters. Obviously, we're getting
What?
a lot of animals coming into the centre, and then no one's coming in because they're happy and healthy. They've come in because they're orphaned or because they've been entangled, they've got puncture wounds, they've been attacked by something. And a lot of the time it needs medical assistance. We're fixing a problem. We're rehabilitating this animal and trying to fix whatever's brought it in the first place. Um, Not a huge amount of it can be done without a vet. Like a good part of the rehab and the physio and everything else can be done with the basis, but you are going to need a veterinary assistance for diagnosis, for medications, and things like that. But working with the vet will improve the recovery time, will improve your survival rate, and it will include and improve your overall welfare.
Cool. So there are a lot of reasons why it's important to work with a vet as a rehabber in the UK. So looking at the legal reasons, we've got the Animal Welfare Act 2006 that we have to abide by, and the Veterinary Surgeons Act 1966. So the Animal Welfare Act covers any animal that's classed as under the control of man. And when it comes to wildlife, as soon as that animal is contained, so whether it's a member of the public's got it or it's trapped in netting, if we've done something to contain that animal, it then falls under the Animal Welfare Act. As part of that, we have to meet the 5 needs, and one of those is to stop them from suffering and to be able to provide appropriate medical care. So that we're legally bound to do that. And although there are some things that we can't necessarily meet, so one of the things that we need to meet is the need for a suitable diet, and we can't always exactly replicate that with wildlife in captivity. We do have a legal obligation to still get them medical care, minimize suffering, and kind of cover that aspect. So that's one of the legal parts. The Veterinary Surgeons Act 1966 means that only vets that are qualified and registered with the RCVS can carry out acts of veterinary surgery, and this includes things like diagnosing conditions, prescribing POMV medication, and carrying out surgery. So that includes doing stitch-ups and anything like that. It's really important that we understand that as rehabbers, we've got a massive part to play in an animal's rehab journey, but there are some things that we can't do, some things legally we can't do, some things knowledge-wise we can't do. And for us to get the best outcomes overall, we need to work together. In the same way as a vet would look at it and go, I don't know how to handle a hedgehog, for example, we need to look and go, I don't know how to decide which medication is best and has the least kind of negative impact on the animal. Another reason is that it helps us make better humane decisions. And one thing that I find particularly helpful is with working with a vet is seeing it from their medical side of things. So I see a lot of cases from a behavioral side of things. So how's that animal going to survive in the wild? Are they going to be able to fly properly? Are they going to be able to interact properly? Can they hunt? That kind of thing. And they can see it from a medical side of things. So if you look at like a wing, for example, that is broken, they can look at it and go, right, I know that this injury in 2 years' time is going to cause arthritis, or is going to limit the movement. And so that insight helps me to then make a better decision on the behavioral side of things and ultimately the releasability of them.
I'm going to go with this one. We'll just go down the points and then I'll explain a little bit more in depth on each one. So this is where the vet fits into our wildlife rehab with the cases we see and what they can do that we as rehabbers can't do. So diagnose injuries and illnesses using clinical examination. There's going to be things that they pick up, as Lucy said, they're going to be looking at the medical side of things rather than the behavioral or environmental side of things. So they'll go, maybe this bone wasn't completely formed and it could be a birth defect, but this animal's been okay so far. Maybe, we've got a twist or we've got a ligament injury, but they can also go ahead and do things like x-rays and ultrasounds, which can then confirm. So as rehabbers, we aren't able to have an x-ray in our site as much as I'm sure most people would love to. Unless you have a vet on site, you can't be doing x-rays because you'll need the lots of other legislation to go with it. Prescribing and administering controlled drugs. So there's lots of different drugs within the schedule, and we have everything from Loxicon, Metacam, which are very basic, like ibuprofen, paracetamol kind of things. They are given quite a bit in wildlife rehab, I'd say. I say we at least have 2 to 3 patients in that are normally on that. However, you also have ones like buprenorphine, which are more controlled drugs and need to be signed out. Now it's going to be the vet's decision where the animal's pain scale sits. So they're going to go, this injury actually is going to need a higher amount of pain relief and analgesic, or no, we've just got a little bit of inflammatory, and they're going to sit it where they think it needs to be sat and then dose from that one. Also on that topic, a lot of different species have a lot of different dose rates. And within dose rates, you also have dose rates for small injuries and ailments and large ones. So the scale is ever sliding. They actually change as well sometimes. They shouldn't overly change too much, but I have known a few drugs in the past change on their compendium on their drug dose rate. There's also new drugs that come out with toxicities. So Panicure in birds, that one's quite new. That's come out that it might be a little bit toxic to birds. So there's ever new research going into this. Performing surgeries, x-rays, and advanced imaging. Again, we covered that on the first one. The x-rays, the ultrasound. I think as a rehab, with the cases we take in, we probably x-ray 2 to 3 patients per week at least. I don't know about you, Lucy.
We don't do as many. We take in about 1,000 animals a year, and I would say, well, during busy season, we probably do 1 or 2 x-rays a week. But it goes in waves, really, I tend to find.
Yeah. I think there's certain things that you just need the x-ray for.
Mm.
So with birds, they've got these 3 bones right in between almost the scapula and their wing joint. And there's 3 tiny bones, and it's really difficult to know if you've got some swelling or you've got a break in one of those bones. So things like x-rays and diagnostics, things like that, very important. Euthanasia, using medication. Obviously, it depends where you're at with euthanasia, to whether you're using, there's lots of different forms, there's captive bolt, there's drugs, there's cervical dislocation, they're all appropriate forms of euthanasia. I tend to go more towards the medication side, but that's just personal preference. But you can only administer the euthanasia drug if you are a licensed vet surgeon or you are a veterinary nurse acting under instruction, and that is instruction to the amount. So you can't think it's 3 mils. 3 mils doesn't work. You give an extra mil, you have to give the amount that is prescribed and instructed by the vet. Interpretation of blood work and diagnostic test results. Blood work, when you see it on a screen, is very intimidating, especially with a lot of the patients we see. So when you go under, I think you've got IDEX, trying to think of other lab places.
Use PALS.
IDEX PALS. Yeah, there's quite a few different ones, and they just come back and it's like RWC, which is
What?
RWC? Yeah, red blood cells and different bits like that, and it will just give you a number. Sometimes you can have that number next to a normal range, but with a lot of the species that we see, they're not, because you don't have standard bloods for a juvenile pigeon as you would a juvenile dog. So a lot of that interpretation is down to the vet, what they think a normal range should be, and their understanding of it.
So as rehabbers, we do have some limits of what we can do legally, ethically, when we first look at animals, and the things that we can do and things that we can decide. And then there are some things that we can do if we have a good vet relationship and if they're able to kind of oversee what we do. So I think one of the big things is that people worry about working with a vet because they think it's going to cost a lot because you have to go in and have a consult each time. But there are ways that you can have a relationship whereby you have a protocol. And so, like for us, for example, if I see something in particular, i.e. a bird that's been caught by a cat, I use WhatsApp. I will WhatsApp our vet. I will send her a picture. I'll send her our admission form, which will have like the bird's weight, any injuries, anything, any concerns I found. And I'll send any pictures or videos of wounds or of the bird's demeanour. And then she's then able to respond and go, yeah, you can do this protocol and I want it for this amount of time. So it's not as scary as it sounds. Once you've built up that relationship, it can work quite smoothly and you don't constantly have to be traveling animals and doing things like that. There are ways that it can work for both of you, and we'll cover that later on in the presentation. And then, as we've mentioned, there are some things that only vets can do. Some of the areas where it nicely overlaps are things like pain assessments and kind of where to go with that kind of thing, because although you've got your pain score, and so it's based on lots of different things like demeanor and things like that. Because you're used to seeing that species, you'll be able to say how painful you think they are. If they're really hunched, if they're not eating, and it's a species that would normally eat, you can then give that information to a vet. Whereas if they were to look at it, they might just think that it's that it's scared. And we will often get it where we'll have animals come to us and the vets have said they've been nice and calm and relaxed, and actually knowing the species as we do, we know that actually something really significant's gone on. So that's a nice way that we kind of work together. But obviously we can't do anything about that pain without having a vet on board to be able to help us when it comes to prescribing a medication and looking into what is actually going on to cause the issues.
So benefits of working with a vet team. I work with a few different vet teams, and I selectively use each one's different ones for different tasks. So whether it's medications, surgeries, diagnostic imaging, but the imaging veterinary centre that I use, they haven't got these big fancy machines that some people think we need, and also some vets think that we need these machines to x-ray birds or smaller species. You can do it on regular machines. You just need to change your voltage. The radiography reveals fractures that we won't be able to palpate, fractures that we won't be able to see, even ones where there's small higher line fractures, so that could equal a weakness or a lameness, but it's not a full break, so we could rest it. Internal, I'm sorry, internal injuries. There any mass? Wait, lost. Sorry, technical issue. Yeah, so a lot of internal stuff that you can't see. So when you're talking RTAs, like road traffic accidents, deers, badgers, the larger creatures, sometimes there's a lot of blood pooling, and we can use ultrasound to detect that. Because once we have them knocked down, we kind of want to get it all done and dusted in one go. We're gonna see, can we find where this bleed's coming from without opening this creature up? Is it a viable case? But also this means we've got an effective, quick way of triaging and seeing what's going on. So a lot of the time, my diagnostic vet I've got on call, if I know I have someone going out to an RTA animal, I'll probably call them. They'll probably be lined up. They're great. We've worked with them for probably about 6 years now. We've got a really good relationship, but they are under a lot of instruction from us, which is great because they listen to us. And we can go, we think it's this area, or, it's a X animal coming in, you're probably going to need to sedate it. And we can also go in and help them sometimes restrain the animal to do these medications. And that's the thing, they're probably not confident on handling or restraining these animals, but they are confident on their surgical or diagnostic ability. So sometimes it's working hand in hand with those. Appropriate medication. There's been a lot of medications that we've needed for selected cases that we've had to order in through our vet. The great thing of working with multiple vets is you can sometimes call round and see if the other one has the medication you need before you order it in. But there's been some medications that we have in wildlife rescue, which are predominantly farm medications. I think I can count probably about 2 or 3 that we use, which are farm ones. Are you still using farm?
Yeah. Yeah,
Yeah.
we've got a few that are still.
But they are drugs that we have to order in. Our vets are really great. They will have a look at a few different sites where they can order from and find us the best prices for that with the quickest turnaround time. Because obviously, if you need medication, you don't want to be waiting a long time. But because they're also as invested into the cases as we are, they fully support that. Better release outcomes. I've had some vet practices who have worked on cases with us actually ask if they are able to be there for the releases, which is great because you can see we're both working towards the same thing. It really involves them, but also like a lot of our animals wouldn't have got through without their help. They wouldn't have come through and had full mobility or able to put full pressure onto a limb without, the diagnostic and the surgical ability of the team. Advanced care, surgical repair, fluid therapy, wound debridement. Wound debridement's a massive one for us, especially with strimmer hedgehogs. They don't want their wound fully cleaning and really getting in there while they're awake. I don't want to do that to them. They don't want to do that. And our vets are great. They have a really good way of doing it, which means they're going to cover the area with gel after, avoid any debris getting in. But it's a really, really deep clean for the first time if you're doing wound debridement.
This picture here is a duck that we had in a couple of years ago, and this is dental putty here. So she'd had a fishing hook in her beak, but she'd also split the front of her beak at some point, and so they used the dental putty to hold her beak, to like put her beak back together. And she went on, she was able to be released. So although they might not necessarily have specialists in wildlife or specialists in birds or anything like that, a lot of them are really adaptable and can think on their feet and kind of figure out ways to help the animal even if they've not got specialist kit.
You just need someone that's interested, I think.
Yeah.
I
Yeah.
mean, we've got specialists that work with us who are absolutely brilliant, but I probably also work with 2 or 3 vet clinics that are domestic cattle dog, and they've gone out their way to do things for us that maybe the specialists wouldn't have. So we have a tiny 3 vet branch practice over in Gloucester, and they pinned a gosling, 2-week-old gosling's leg for us, free of charge, completely.
That's always nice.
It
That's
is,
nice.
isn't it?
We're not as lucky in Lincolnshire, so most of the vets that we work with are just general like GP vets, so your cat and your dog ones, and then we've got a couple of farm vets that we work with. But it's finding the individuals that are enthusiastic and want to learn and things like that, and that's where you get your best outcomes. They don't necessarily need to have the knowledge initially; it's just that desire to learn. And I'll talk about that a little bit more in a couple of slides. Just briefly skimming over the dangers of not working with a vet, and I'm only skimming because we've covered a lot of these. But I think one of the biggest things that I see as a rehabber, I've been doing this a little while now, and so people come to me for advice about what to do and where to go and things like that. And something I see ever increasingly is people using medication that either has been left over from another animal or that they've ordered online. Now, one of the massive problems with this is that they're just being used completely inappropriately. And there are medications that we used to use readily when I started that I would very rarely touch now. So Baytril, for example, when I first started, we used it all the time. We used injectable and everything got it kind of thing. And it was like, the first port of call. But as veterinary medicine has improved over the years and people have learned, they've found out more issues that it has. So if you're injecting it, it can cause necrosis if it's not being diluted. So it can actually kill the skin around where it's being injected in. And also if it's used in juvenile animals, it can cause problems with their bones that can go on to cause long-term issues and would probably mean that they wouldn't be able to be released. Another thing that I see used an awful lot is Metacam, and Metacam's fantastic. It's an accessible painkiller, and I say that because if you speak to a vet, they will prescribe it as a first port of call, not accessible in that you can get it however you like, kind of thing. But it does need to be used under veterinary direction. Emily mentioned earlier about different dose rates and things like that. And you do have to dose things properly. So the metabolism of a bird, for example, is much higher than that of, say, a hedgehog. So for a hedgehog, it's 0.2 mgs per kg for a hedgehog. Whereas for a bird, you can give up to 1 mg per kg twice a day. So that's a massive difference in amount that you're giving and amount that the animal needs to actually feel the benefit of the medication. And unless you're working with a vet, it's difficult to know kind of where to go on that scale. The other thing,
there's also
go on.
with Metacam, there's also times that you can't use it if it's not eating, or if there's a head trauma, you're not meant to be using it.
Yeah. So there's lots of times when you wouldn't want to use it, as Emily mentioned. So if they're not eating, if they've got head trauma, if they're dehydrated, it can cause lots of issues. And there are various other drugs that can cause lots of different issues. So terbinafine, for example, for hedgehogs can cause liver issues, and so it needs to be used appropriately and managed in that you keep an eye on the animal, how they're doing, report that back to the vet, so then you can adapt the medication as you need to. I wouldn't expect everyone to know everything about the species that they're dealing with, i.e. like their husbandry, where they need to be released, that kind of thing, and also know everything about all of the drugs and keep up to date with that kind of thing. So I think that's another reason it's really good to work closely together. We're just going to have a quick look at how to start a vet relationship, and this is something I get asked about quite a lot. It can be tricky to start vet relationships, and particularly now in a climate where a lot of the vet practices are owned by corporates. When I first started out, most people were independent, as in they were independent practices, and I have to say it was much easier to build relationships with vets then. And as more places have been bought out, we've had to change how we work with vets and kind of adapt things. But a good way to start new relationships is to get in touch with them, send an email or a letter, or go in and just introduce yourself. So rather than going in straight away and being like, right, I need a new vet and this is what I want from you, if you go in and explain who you are, what you've done, where you've learned things, that's a really nice starting point, because wildlife rehab obviously isn't regulated, as we know. This is kind of why we like the wildlife care badge. They have nothing to compare you to someone down the street who's doing a terrible job. So if you can go in and look approachable and professional and have a good conversation with them, you stand a much better chance of getting a good kind of start with your vets. Once you've got past that point, you can discuss with them what kind of support you need. So are you looking for emergency consults? Are you looking for them to be your only vet, or are you using lots of vets? So Lincolnshire is massive and we've got vets all over the county that we work with. And so when I'm talking to a new vet practice and asking them to help, I'll emphasize the point that we work with more than one, and it's purely based on which vets the animal is closest to. So it's not the same as like if I were to take my dog to a vet's and have him registered there, I can't then register him at another vet's, because it's just not the done thing. But as a rescue, you can work with multiple vets. And so we emphasize that point because I think one of the things that they worry about is that they're going to get overloaded with wildlife cases. And so I'll always emphasize that we work with lots, and, this is the kind of thing that we deal with and this is how we operate, kind of thing. And then from there, you can agree on what you're going to do, like the practical things. So how are you going to get in touch with them? How are they going to get in touch with you? What's the best way? Is there a protocol for if someone drops off an animal with them, or does everything come through you? Do they need to come out and do visits? And then just build that up slowly. I think if you go straight in and you say, right, I want a vet and I want them to come out to me once a week to do a check, and I want SOPs, and I want you to give me a bottle of Metacam and an injectable bottle of Sinulox that I have, and you just tell me when I can use it, they're just going to go, no, they're just going to run away, because it's their registration at the end of the day to be able to trust you with medications and write SOPs and things like that. They need to build it up, and they need to see your competency. And equally, I would say as a rehabber, you want to be able to see their competency and their commitment to working with wildlife.
Veterinary nurses. This is my part. So I saw the majority. So in my time in practice, when I was actually working in a vet clinic, I saw the majority of wildlife when I was there. And I think my practice in particular were amazing. They let us do a lot for wildlife, but they were a private vet practice, so they weren't owned or overseen by a corporate company, and they had a lot of care for wildlife. But through that, I worked with a lot of the other nursing staff, and our vets would let us do stitch up. So we can do x-rays, we can do imaging, we can do stitch ups, anything like that underneath a veterinary care. So the vet is in the building, but we can go off and do that. They will tell us what drugs we're allowed to use, how much drugs they are, put it all under written instruction, but we are still able to do the stitch ups. As long as you're confident and competent, you can go and do that. Through doing some of the stitch ups for the wildlife, and I still do it to this day, I'll go locum at another practice, and sometimes I bring my own animals along, get some bits done. But through doing that, you're massively having the charge reduced because you're not paying the same rate for the veterinary nurse's time as you are for the vet. And they're great. I know so many lovely vet nurses, and I think I've got a few vet nurses as well on our fostering system. So they have some of the young neonatal animals for us, and they will rear them. They're caring and they're confident and they're competent, and you can ask for much more from a person looking after your wildlife. I trust them with anything I have. They're one of my first go-tos. But it definitely does bring down the cost having the vet nursing do it a little bit more than the vets, and they are very competent. You should believe in them. They've gone to school, they've gone and trained, they do their CPD hours. I think a lot of people see them as receptionists almost, or but actually they are trained to take blood, they are trained to do x-rays, they are trained to give medication. They have a wide range of skills. I think we've covered delegated clinical care, so anything the vet says to go and instruct the vet nurse to do, they can go and do, so they can go and administer the medications. Knowledge sharing and training. The rehabilitators can come in. So I've done it to a few practices. I'm sure Lucy has done quite a few herself. It's almost like a trade of skills. We go in, we're going, okay, this is how you handle a pigeon. This is how you crop feed. This is how you make sure the animal's comfortable while it's in your clinic. And you're kind of engaging more. You're working out having a better time for the animals that are going to be in there. So, if you're sending a pigeon in and they don't actually know that it needs or how to assist feed the pigeon, or they don't know how to place a perch or any of those kind of things, and the pigeon's laying flat, it's not great post-op or post-consult care for that animal. If you go in, tell them how to do it, show them how to do it, work through any questions with them, they're a lot more confident and your animals are a lot more comfortable in their care. Enhanced support network, strong relationships with vet nurses, does insist on high quality care. A lot of the time they're the ones out the back. So if you've got an animal or someone's dropped off a baby bird, it's not normally the vet which is out the back with them. The vet's doing the consults. The nurses have more time and they have more availability. Not much at all, but they do have more time, so they can go in and make sure that baby bird's getting fed when it's needing to, making sure it's getting the right care. Stress levels are maintained, not maintained, or stress levels are kept down, but they are going to be doing more of the one-on-one care with that animal than you think.
I would agree with you there. I have to say, most of the vet relationships that we've built have started off with vet nurses, in that they've contacted us because they've got an animal and they want some advice, and then you kind of build that relationship from there. Because, as Emily said, they're the ones that do a lot of the hands-on stuff with regards to like the husbandry, so setting up the enclosure, feeding the animal, doing those assessments, doing the x-rays, because they're able to do the x-rays and then the vet can interpret them. So they do an awful lot of the work and the discussion. They talk to the members of the public when they bring them in, that kind of thing. And if you've got a nurse that's particularly passionate, they're able to guide the vets to do a little bit more. So when I worked in practice, nobody in the building cared about wildlife, as in, not that they didn't care at all, but it absolutely wasn't a priority. And then I came in, luckily for them, and I kind of made them care. So I made it my business to get those animals care, and then more and more of the vets started to pay attention to the wildlife, more of the nurses did, they got more interested in everything, and we ended up with two of the vets that I worked with as fosterers, and actually they still, this is just over 10 years down the line, they still see wildlife for me. And before I had gone in, they weren't really interested in wildlife at all. And a lot of it wasn't that, they're not bad people. It's not that they're not interested because they're horrible. It's just that they'd never dealt with it. They had no confidence to start dealing with it. And all it needed was a bit of a push and that reassurance that they can do it. And so sometimes by teaching little bits, you can really boost the confidence of them, and then you'll get much better care and interaction. My dog's standing on me. Stop it. Sit there, good boy.
They are also some of the best fosterers I've ever had, because a lot of the time the problem's already been looked into. If you've got a sickly animal and you've placed it with them, the problem's already been looked into by the time you hear about it.
Yeah, definitely. And for things like wound management, so sometimes we'll have animals that have got quite significant wounds and it's not something we can manage in rehab. They'll stay with a nurse or with a vet to through that bit of their care. while wounds are managed or why while certain things are done, and then they'll come on to us. So that's quite a nice thing to be able to do. You do have to put quite a bit of effort into maintaining a good working relationship with your vets. But I think that's the same with anything. And I don't think it's fair for us to say, well, we've worked with them once, and so therefore they should do everything. They should do things for us. Realistically, a lot of the time we're asking for things discounted or free, and as a lot of them are corporate now, they're much more pressured for their time than they ever were. The pressures on people working in vet practice now are crazy, and I've got friends that are still in the industry that are just, they haven't got time to go and have a drink, let alone have a big consult or anything like that for free. A lot of them are working through their lunch breaks, and so we do have to understand that and empathize with that. And obviously we do need to get the animals care quickly, and it does need to be competent care, but there's a way that we should speak to them and kind of lead that discussion that isn't accusatory, in that they don't get during their training time, so during the courses that they do and things like that, there's not very much time at all that's dedicated to wildlife. And if it's not their passion, it's unlikely that they'll know various things. So, like canker in pigeons, they might not know to look for that. I would know to look for it because I care about pigeons and I do a lot with pigeons. But if they've never held one before, they might not know what to do. And we get a lot with birds of prey where they just don't know how to handle them. And so they've not given them a thorough assessment because they don't know what to do. And by giving them helpful advice rather than just saying, oh, you've missed this broken leg on this kestrel, rather than just reprimanding, if you can go in and go, right, well, this is what I found, would you like me to show you how to handle in future? If you can phrase it in a way that's kinder, then you're much more likely to get a good result. And I know firsthand how frustrating it can be when you get repeated things that are missed, or you're not listened to. I know how frustrating that can be, but we need to try and frame things in a way that doesn't make them feel attacked and allows them to learn more, and then you will end up with a much better kind of relationship, particularly if you're trying to get things for free or lower cost, or at silly hours of the day, that kind of thing. If you can just kind of not hold your tongue, but if you can be the
Professionally present it.
yeah, just be really professional with things. And I know it's a very emotive thing. If you're able to put that forward professionally, then you're much more likely to get a positive outcome. So it's just a case of showing your appreciation. And I love a compliment sandwich, in that you'll say something nice, you say what needs to be improved, and then you say something nice again, and it does go a long way. There will be things that they get wrong, but equally there are things that we will get wrong. We'll miss things and we'll do things incorrectly, and so it's just kind of accepting that and moving forward, and trying to maintain things. That's not to say if something's deliberately done poorly that you should just ignore it. There are things that you should definitely do in that case, but just being kind and not expecting them to know everything. I think that's where a lot of people go wrong, is they expect them to know what they're doing, and they don't necessarily. So if you're able to, my vets, they must hate it. I send them emails with papers that have been released. I send them emails with links to CPD. I take pictures of books that I've got and send the information to them from it. So I'm constantly giving them extra things so that if they wanted to read more, they can, rather than them having to go out and find it.
I think that's one of the big things as well, because when I was in university, we got a half a lecture, which is probably equivalent to an hour on wildlife. And it was more about ethical decisions than anatomy and physiology. Probably had a similar amount of time on birds. We did not have long. You learn about cats, dogs, tiny bit about rabbits, tiniest, and then you learn about farm animals. So I think it's probably stems more from intimidation. Like, it's very intimidating working on a species that you haven't been shown step by step how to. And it's just the lack of education. Like, these people care. They're in this industry because they care. They don't want an animal to suffer. They don't want an animal to be in pain. But in the same breath, they've not been shown.
Yeah.
And it is very intimidating. Like, how intimidating is it for us? I know, especially myself, if I have a species that comes in, I've never worked on it before. And I'm like, oh my goodness, what am I gonna do? I'm constantly reaching out to help for help, calling someone who's a specialist, calling another large rescue, calling Lucy and bugging her. Everyone needs someone to troubleshoot off, and they're just in this bubble of people that have had the same education sometimes. And also CPD is not cheap. We have to do a set amount of time. But if you look at some of the wildlife CPD courses, they're available, they are there. Your practice is unlikely to pay for them because it doesn't benefit the practice. I mean, that doesn't speak for all practices, but it does speak for quite a lot. They'd rather you go on a nutrition course for a cat and a dog than they would wildlife first aid. And it's, we're talking probably upwards of £300 to complete a CPD course or an in-depth good CPD course on wildlife sometimes if you're looking for a long one.
That's another way that you can help maintain your relationships is by going in and delivering CPD. So if you go in and do like a lunch and learn, for example, which is when you go in at lunchtime and you take them some food and you tell them about wildlife, not only does that help them get to know you and gives them some more information about wildlife and what they might see and how they might deal with them, but it also adds to their CPD hours. So they're able to note that down. All you have to do is give them a little certificate and then they can note that down on their CPD log. And so even if they're not necessarily interested in wildlife, you can get a good number of vets and vet nurses to come along to talks because it knocks down their CPD hours. And then during that time, you can make them enthusiastic and you can, give them a little bit of extra information that might help. There are obviously quite a few barriers to vet relationships. Some of it is the cost of using vets, and I know this is something that people struggle with, but I think if you can get a good relationship with your vet and you can have the discussion with them and you can make it a two-way street in that you say say for example you do hedgehogs. If they have a hedgehog brought in, they can ring you and you'll collect it. And one way that I work with vets that seems to work is I will say to them, if they have an animal brought in, if they ring me within 24 hours of them calling, we will have had that animal collected. Obviously, if it's a species that we deal with and we've got space. And that's worked really well because then I'm giving them something back. I'm giving them an out. They know they're not ever going to have an animal stuck at a practice. I'm able to take it from them. And so it does work out as a two-way street. And then I'm obviously giving them things like education and stuff like that. So then that makes it a much more mutually beneficial relationship, because if all we're doing is going in and taking, then it's often not worth it for them, particularly with the pressures of corporates. Geographic access can be a problem as well. As I say, Lincolnshire is not known for its exotic vets, but if you've got a vet that's keen, then they can contact the wildlife hospital. So, for example, our vet recently, we're having a look at our parasite protocols. She's contacted Heidi at Vale. Heidi's emailed her. They've been able to have a discussion. So just because they're not a specialist doesn't mean they can't gain the information that they need to. Another reason is that people can sometimes lack confidence when it comes to talking to vets because they feel like they're going to be pushed back or they're going to be ignored or their opinion's not going to be taken into account. And it's all about how you present yourself and kind of how you come across. And if you come across as someone that they can talk to and things like that, then that really helps. Time constraints, I have to say, are the biggest hurdle for everybody. I know if I've got to take an animal to the vets, I know I might have to sit there for an hour before I'm seen. If I've not booked an appointment, that can be really tricky. And I imagine if you're doing things by yourself as a solo rehabber, it's even harder. And equally, vets have that demand from the public to often all their consults are booked, and so they don't get the free time to see wildlife. So it can be tricky, but the best way to get around that is by just talking, just being open and saying, look, I haven't got the time, or I can't afford to drive an hour to you, with every single animal I see, and they'll go, I haven't got the time to see you every single time you've got a hedgehog that needs to be seen. Right, well, how are we going to work this out? We'll sit down and we'll write an SOP, something like that, because that it's that open communication that they need. So to be able to set up an SOP and for them to be able to trust you to do meds appropriately and contact them when you need to, you need to be able to have open discussion, and that's the main point of it all. So just to summarize, because I appreciate we've gone on for a little while, there are a lot of legal reasons why you need to be working with a vet. We've got the Wildlife and Countryside Act 2006 and the Veterinary Surgeons Act 1966. The whole point of all of this is to be able to get the best outcomes for the animal, so make sure that they're given every chance possible to get back out into the wild or for their suffering to be relieved. We want to have the best outcome, whichever that may be, because the last thing we want to do is throw an animal back out into the wild and for it to be the wrong choice and for them to suffer just because we didn't understand the situation. It can be tricky to build relationships with vets, but it just perseverance, open communication, having proper discussions about everything in a professional way really helps. And just being consistent with them, saying thank you now and again, paying for them to go on the odd CPD really helps as well. A box of chocolates here and there. And you will sometimes get a box of chocolates back. So it is worth it. It's definitely worth it for the animals. And that's what we're all here for anyway.